Have you ever stopped to think about who actually designs the master plan for a nation's health? Well, that's basically what health policy is. It's the blueprint behind our entire healthcare system, and it shapes everything from how a hospital gets its funding to the public health ads you see on TV. So let's dive into how it's actually made.
And that is a great question, right? I mean, why do some diseases get these massive research grants while others kind of fly under the radar? Who's making those really tough calls? Today, we are going to unpack exactly how those critical decisions get made.
All right, so to kick things off, let's get a really clear understanding of what we're even talking about here. What exactly is health policy? At its core, you can think of health policy as a strategic roadmap. It's not just, one law or a single rule. It's a whole collection of decisions and plans that governments and big health organizations use to steer a country towards its health goals. It's the official game plan. And the purpose of this game plan is absolutely crucial. It's all about creating a shared vision for what a society's health should look like in the future. It makes the top priorities super clear, and this is just as important, it spells out who is responsible for what. From the government all the way down to doctors and even patients, everyone gets a defined role.
Now, these big policies don't just appear out of thin air. They are carefully, methodically constructed. So let's look at the 4 essential steps that go into building this health blueprint.
Okay, so the whole process kicks off with step 1, problem identification. This is where leaders go, hey, we've got a problem here, like rising diabetes rates or a shortage of doctors in rural areas. Next, in step 2, the experts get to work on policy development, brainstorming all the possible solutions. Step 3, consultation is vital. This is the listening phase, where they go out to the public, to doctors, to patient groups, to get their input and make sure the plan is actually practical. And finally, you've got step 4, decision-making. That's when the policy gets the official green light and becomes law or official strategy. It's a real journey from just an idea to a concrete plan.
A beautifully written policy is pretty useless if it just sits on a shelf collecting dust. So this next phase is where the rubber really meets the road, turning that blueprint into actual, real-world change. And this happens in 3 key stages. First, the policy gets translated into detailed action plans, assigning budgets, putting people in charge. Second is capacity building. You have to make sure the hospitals, the clinics, and the trained professionals are actually in place to do the work. And finally, there's constant monitoring. You've got to track progress with real data and be ready to make changes if things aren't working out the way you'd hoped. This brings us to one of the absolute toughest parts of the job. You've got limited money, limited time, and this long list of health problems. So, how on earth do you decide which issue to tackle first? This is where it gets really tricky, and you can see it's a huge balancing act. Leaders have to look at the disease burden, how many people are affected by something, and how badly. Then they analyze cost effectiveness, asking, where can we get the biggest bang for our buck? They also have to consider equity, making sure they aren't leaving disadvantaged groups behind. And finally, there's the political reality of public and political acceptance. I mean, a brilliant plan that nobody supports is a plan that is going absolutely nowhere. It's a really complex decision with a lot of competing factors. Okay, so that's all the theory, but what does this actually look like in the real world? Let's take a look at a major health program in Bangladesh to see all these principles put to the test. So, between 2011 and 2016, Bangladesh launched this massive, nationwide effort. It was called the Health, Population, and Nutrition Sector Development Program, or HPNSDP for short. And this thing was a hugely ambitious 5-year plan. This quote right here really gets to the heart of their mission. See, the goal wasn't just to improve healthcare in general. It was to do it equitably, with a special focus on those people who are so often left behind. That idea of equity was completely central to their whole policy.
So, the big question is, how'd they do? Well, the results were really impressive. They saw these major drops in both maternal and child mortality rates, 2 incredibly important health indicators. More moms were giving birth in proper medical facilities, immunization rates shot up, and they physically expanded and upgraded clinics and hospitals all over the country. These were some major victories. But, and this is a big but, it wasn't a perfect story. The program ran into some very real-world challenges. They faced resource constraints. I mean, there's never enough money or trained staff to do everything you want. The health gaps between people in the cities and people in the countryside remained a really stubborn problem. And the way the policy was carried out wasn't always consistent from one part of the country to another.
This mix of incredible success and real struggle, it provides some powerful lessons for all of us. So, what are the key takeaways from Bangladesh's ambitious 5-year plan?
This table lays it all out pretty clearly for us. On the strength side, yeah, it had a comprehensive design, it had strong international support, but the weaknesses are really telling. It didn't focus enough on the rise of chronic issues like heart disease and diabetes. And there were some real questions about sustainability. Could the progress actually continue once all the major funding and attention moved on?
And this all boils down to 3 absolutely critical lessons for anyone making health policy, anywhere in the world. 1, you have to involve the people on the ground, the communities, and the healthcare workers from the very beginning. 2, use data relentlessly to see what's working and what isn't, and be willing to change course. And 3, think about sustainability from day one. How are you going to keep this progress going for the long haul?
And that brings us to our final thought for today. Looking at these really powerful lessons, community involvement, data-driven decisions, planning for the long term, which one of those do you think is most needed in your own country's health system right now? It's a crucial question to think about as we all try to build a healthier future.